Pulse of Surgery, a real healthcare experience for a lifetime of learning.
I'm Dr. Nathan Zimmerman. Family medicine is my specialty. I live in Louisville, Kentucky. Been practicing medicine for 57 years, and I retired just 6 months ago. Prior to surgery, essentially hard work. Practicing medicine back in those days was constant, 7 days a week, almost 18 to 20 hours per day. I did exercise on a regular basis. I jogged way before other people were jogging. When my hip went bad, I started walking, and I continued to do that until I had the surgery. I ate everything, and it made no difference to me whether it was good, bad, or otherwise, to be honest. I averaged probably around 190 pounds during that period of time, which was certainly 20 pounds overweight for me, or even more than that. No history in my family of diabetes, other than my mother, who I remember might have had it. She died at age 53 with hypertension and a cerebral hemorrhage, brain hemorrhage. My brother had bypass surgery when he was 55. He died when he was 65 of a closed down coronary, so that was a family history as well. I had a heart attack at age 53. Now, I don't think that was coronary artery heart disease plugging it up, because they had found nothing after the original, hardly no residual. I had been lifting weights and got into it too heavy one day and started having chest pain. And they felt that was what we call a cardiospasm or a coronary artery spasm. But we never know, and we never know the difference. The point is, I had previous factors which led to this, and the inevitability of a bypass was not surprising. I smoked from age 17 when I went in the Navy, and I continued to smoke until 1963. So it was really about 16, 17 years. In those earlier days, 90% of the people that I knew were smoking. And the family, same way. My children, some of my grandchildren, even today, they still smoke. As ridiculous as it may sound, especially in the light of the fact that their grandmother died of cancer of the lung. I did not know that I was going to have any problem with coronary artery heart disease until I had chest pain on the Friday night prior to going to the emergency room. There was no warning whatever. I had no angina or any chest pain. I had no symptoms. I was perfectly healthy. It was so far as the heart goes. Previously, I did have hypertension, and I still have hypertension, which I treat. The weight problem was still there before the heart attack, because I've lost it all since then. I've lost close to 40 pounds. And I've gained 20 of it back. In either case, I had no premonition that I was going to have a heart attack or require bypass. And I went to the hospital with a chest pain. They cathed me the next morning. They showed me the pictures. They said, you have no choice except one. I had 82% occlusion of my left main, which may not mean anything to the younger people watching. But that is, in medicine, is called the widowmaker. It's a bad one to get clogged up. 82% occlusion of the left main is bad news. I had chest pain on Friday night. 15 minutes of it, we were going to go to dinner with some of our children. I said, take me to the hospital, the emergency room. I'm having chest pain. The pain only lasted 15 minutes, never came back. First original thought in the emergency room was everything was okay. But they wanted to be sure because of the chest pain, so they did a cath the next morning. Then on Monday morning, the operation occurred. That was very quick. Frequently, with a major occlusion of the left main, they will operate on you the same day. They take you right from the cath lab to the operating room. This didn't occur because it was on a Saturday. So they waited till Monday for that. I was given enough medicine where I didn't remember even being on the table. I remember the last thing I sang, my family wishing me the best, and my wife kissing me goodbye, at least goodbye for the present. And I do not remember waking up in the intensive care while being intubated. I am told that the next day when they took the tube out, that's a breathing tube, that my wife came in and at that time said, "Do you know who I am?" I went into intensive care for about a day and a half, 2 days. Then they went to critical care. And other than that, things went along pretty smoothly. I had one very bad night, and that was about 4 or 5 days later. I was short of breath with it and such as that, but they took care of that. Do I think that the coronary artery heart disease problem was inevitable? It's hard to answer. If I had maintained my weight and continued to not smoke during those early years and eat more nutritionally balanced diets, heart healthy diet, certainly that 82% might have been 68%. I really must say that I wasn't concerned about dying going through the procedure. I trusted the surgeon that I had, and I'd seen so many of my patients over the years have bypass and survive and do well. I think the percentage is about 3% where there's a failure. And I really wasn't concerned with that. I wasn't anxious to go through the procedure. I wasn't looking for that, but I knew that would have to happen. I have a great faith in the practice of medicine and in medicine and medical technology. I've had it over the years. I think the technology is remarkable. And I trusted the doctors that were taking care of me. My decision to go to rehab, where I stayed for between 10 and 14 days, I don't remember exactly, was remarkable in terms of people recommending that I do it. All of my friends who were doctors said they had gone, and it was an experience that you shouldn't miss because rehab will make you do what you don't want to do. And that's what my trainer does right now with me. He makes me do what I don't want to do. So as far as the rehab went, that was terrific. They had me walking, riding a bike. I mean, on the 7th day, I was active. There's your normal, up to 200 on total. And then, of course, you get into the elevated numbers of cholesterol. My cholesterol reading without medication was 317 on the total number. The HDL was about 90, which was very good. The LDL was too elevated, at 140. Because the procedure is just a procedure. They still can be subject to problems beyond that. And heart healthy diet, weight loss, exercise, all that goes with it, avoiding diabetes, a lot of things that they have to insert into their lifestyle. And listen to what their family tells them. A young person who reaches 19, 20 years of age and has enough wherewithal to think for himself and to listen to the doctors, etc., about the various things that they can avoid to keep from getting coronary artery heart disease, that's a hard change. I mean, they're going to smoke because they want to smoke, and they're going to eat what they want to eat, partially because they were trained to eat that way. The human body is a great machine. My wife and I have talked about this very often. She has as much appreciation for it as I do. It's a great machine, and it has to be treated like a great machine. You can't abuse it, otherwise it's going to break down. My advice to any young people would be, remember that changing your diet is difficult to do, but do it. Smoking is a habit for the young people, but it's dangerous in lots of ways beyond that which people lecture you about. So stop it. Weight, number one in the state of Kentucky, obesity. Diabetes is almost inevitable when you get up to the obesity levels that people get. I think that my grandchildren are taking this seriously. And they have watched all this, and we have 17, 19. And I think they're taking it seriously because they've spent a lot of time with me since the surgery. I spent a lot of time at dinner and in evenings at their homes. And I'm very close to all of them. That's exactly what I'm going to do right now, spend more time with them, travel, spend more time with my wife. I got a lease on life.
Pulse of Surgery, a real healthcare experience for a lifetime of learning. This program is proudly brought to you by the Louisville Science Center and its supporting partners, the Greater Louisville Medical Society, Medical Society Professional Services, and Jewish Hospital and St. Mary's Healthcare.